Welcome, everyone. I see folks trickling in. All right. Welcome to Bridging the Gap Collective Healing and Systems Change Workshop. This is day 3 of the CPEN conference, Voices for Change. It's really nice to connect with all of you. I see folks join in. Welcome, welcome, welcome. Oh, Carolina, I think I'm seeing your Slack screen. If you make it full screen, that would be great, the PowerPoint slide. You can go to slideshow and then from beginning. Oh, I think, do you have dual monitors? Probably showing the other display setting. That's okay. You can just move the slide. You can advance the slide, but just to let you know what's being shared is the dual monitor screen.
Okay.
Yeah.
So,
hi, everyone. Welcome to Bridging the Gap. We're just doing a little troubleshooting here. Welcome, welcome. So nice to feel you all. I can't see anyone. So it's really like, if it was an actual conference in person, I could see all your beautiful faces. Okay. So we're gonna get started in just a few minutes. We're just trying to get this PowerPoint thing all squared away.
hey, Nihei, what do you currently see right now?
I'm seeing the show taskbar, display settings, and slideshow.
Can you see this? Is it like the black border you're seeing? I see. So
yeah,
I need to make a
Hey, Carolina, if you just check your messages right quick.
I can't see my messages on the screen. Sorry, it's like taking up both of my screens.
Okay, you can stop sharing the screen and I'll go ahead and do housekeeping. Great. Okay, let me know when the slides are ready. But yeah, welcome everyone. Thank you for attending the workshop. We're really excited to have you here today. We have 3 amazing speakers that are ready and they're here, and I'm really excited to introduce them. But first, I'm gonna go ahead and do a little bit of housekeeping to let you all know what's going on. We have the chat box that's happening on the right side. And so if you have any questions or just want to do a shout out during the workshop, you can leave comments or questions there. All of you all are currently on mute, so please use the chat box like I said, and the Q&A features. CPEN staff will be monitoring the chat, okay? We want this workshop to be as engaging and interactive as possible. So at any point, if you want to speak, you can go ahead and raise your hand. And how you do that is you can see in within the Whova interface, there's also a Zoom interface and it says participant. You can click on participants and there is an orange like rubber glove kind of icon, and you can click that and that means you're raising your hand. And so when you raise your hand, CPEN staff will go ahead and unmute you and you can share your thoughts, insights, feelings, or questions. So again, at any point, if you want to raise your hand, you can do that and we'll go ahead and unmute you. If you need technology help, we had some technology issues today. You can go to our tech help and speak to Aviva, our technology guru here at CPEN, or you can call the number 510-832-1160, extension 308, okay? And all sessions will be recorded, and recordings and slides will be available after the conference. And please show consideration and respect for all attendees, so doing active listening as much as possible. I know we got families in our homes and things going on, but as much as we can do active listening and honoring the workshop, that would be amazing. Disagreement with civility and awareness of your audio. So make sure that you're muted when you're not talking. That would be great. Feel free to tweet everything if you feel inspired and engaged. The hashtag is hashtag Voices for Change 2021. So that is a little bit of housekeeping today. I don't know if folks have any questions. You can put them in the chat box and our staff would be supporting you through that. Okay, so we're gonna get started. Please include in your chat box, I'd like you to introduce yourself. And so what's your name? What's your pronouns? Where are you coming from? Cities, counties, communities? And also, to whom do you do this work for? So again, please include and please put it in the chat box. Introduce yourself. So what's your name, your pronouns, where are you coming from, what location, and to whom do you do this work for? Okay, so I'd love to see who you are, where you're coming from, right? And to whom you do this work for. If you can put that in the chat box, that would be great. Excellent. Okay, so while you all do that, I'm gonna go ahead and introduce myself. My name is Mihei Jung. I work as a community advocacy director here at CPEN. I've been here for about 3.5 years. Time is flying by. I am a trained social worker. And so I would say that that's a little bit part of my identity. I'm also a Korean American immigrant. I was born in South Korea and immigrated here when I was in 7th grade. So I'm still Korean, but I'm still American, right? And so that's a little bit about myself. I want to go ahead and get our moderators introduced, and then they'll share with you a little bit of an opening remark. So I'm going to pass it over to Rose. So can you introduce yourself and just share a little bit about like why you're here and what you hope to offer?
Hi, good morning, everyone. And I want to say thank you to the California Pan Ethnic Health Network, to Mihei, Carolina, Stephanie, and Aviva, who have brought us together today in a circle, and certainly to Kieran, who continues to be a mentor and coach to me in this work. I'm Rose Venegas. I'm a Senior Program Officer with the California Community Foundation, and I currently oversee over $5 million in our discretionary grant making, $5 million, and also support a partnership with the LA County Department of Public Health on CARES Act funds supporting community health worker outreach in the communities most impacted by COVID-19 here in Los Angeles County. Thank you for the caring and thought question of, for whom do we do this work? I do this work for my mother, who as a low-wage worker in a health facility was often the target and victim of discrimination. And one day after work, she found that nails had been put in her car tires because folks were unhappy that she was trying to organize her fellow coworkers to file discrimination claims in the workplace. And so that work carried on into my own research, looking at how experiences of discrimination cause poor health amongst women of color. And fast forward to 2021, where we continue to see that our communities of color, women of color in particular, in particular face the most drastic outcomes in terms of COVID-19. So that's who I'm here for. That's who I will continue to be here for, and grateful for the chance to join Dr. Boyd and Ms. Sonia Young-Adam on this panel today.
Thank you, Rose. Thank you. And we'll go to Sonia. Sonia, you're muted.
Thank you so much. I really do echo the comments from Rose from California Community Foundation, especially talking about, why we are here and who do you do this work for? I mean, it means so much to me to come into a space, where the title of a conference is Voices for Change. Certainly something that every one of you on here, every one of the, I think, 50 people who are, a part of this virtual space right now, we all have our own voice. We all lift our own voice in different ways. And for me, I am the CEO of California Black Women's Health Project. And daily, I, echo my voice, lift my own voice for the 1.2 million Black women and girls in the state of California, and the families and the networks and the homes that are represented, by those 1.2 million. And I come and I stand in a space where I'm privileged, really so privileged, to be able to speak out and to speak up on issues that impact health outcomes for our community. And for many Black women, we are, either the, administrative heads of our households, we are the health heads of our homes. Too often we are the heads of our homes, for reasons that are not necessarily good. And we are, called to carry some extremely heavy and challenging burdens for ourselves and for our families, the communities, and even sometimes for the nation. So thank you to the entire CPEN staff and to, everyone that's come together to bring this space. I do hope that we can have a very natural conversation about, revolutionizing health equity and healing and systems change. They are not easy subjects to discuss, but I'm really excited to be a part of this panel with Rosemary from CCF and with Dr. Rhea Boyd. So thank you very much, Mihai.
Thank you, Sonia. We'll go to Dr. Boyd.
Hi, everyone. Good afternoon. I'm Rhea Boyd. I am a pediatrician here in the Bay Area. I work part-time clinically in a community-based urgent care in the South Bay. And the rest of my time I spend doing teaching, writing, and researching about the impacts of racism on health. I have a particular focus on the impacts of policing on child health. And I'm so honored to be here today. Often when I do teaching, people want to talk about systems work, but they don't want to talk about healing. And I think for those of us who work in systems and are from communities that have been impacted by the forms of oppression that we are all fighting, sometimes there isn't enough space for us to talk about healing, which is for the populations we serve, but also honestly for ourselves. So I'm so, honored to be a part of this space you guys have created, Mihai and the rest of CPEN staff. And I appreciate this starting with who you're here for. I think all of the work that I've done in my short career over the last 10 years is really for Black folks. And it comes out of my love for my own family and the love that's been shown to me by my own family. I think there is a deep-seated love in the work that I do. And I think that love is part of why I want to talk more about what it means to heal, because I think that love can be really transformative. And it's from understanding and trying to position my career to better what Black folks need that allows me to think more about all of the populations who have been impacted by forms of oppression or persecution that Black folks are in solidarity with. So thank you for having me.
Thank you, Dr. Boyd. I just already feel my heart. Anyway, so I think before we jump into more of the content of the discussion, I wanted to offer all of you opening meditation. We're talking about healing, and we know that as much as we need our head, we also need our heart and our bodies, right? And so it's really important that as we do this work, as we move forward, that we pay attention to what's going on with our body. And so I'm going to have all of you sit down, and if you're doing things, you can take a moment to sit tall and close your eyes. So we're going to sit and close your eyes. Okay. Take a deep breath. Feel the air move through your nostrils. Feel the chest expanding in all directions. And at the top of your breath, breathe out through your mouth. Let it all go. Breathe in. Breathe out. Breathe in. Breathe out. Start to notice what is going on in your mind. Are there thoughts that are coming up for you? Are there feelings in your body? Are you getting lost in a thought? Start to bring that awareness into your body. Feel what's going on in your shoulders. Start from the left side of your shoulders, cross through your neck, and to the right side. Are they tense? And if they're tense, try to move your shoulders a little bit. Wiggle them. Feel your back against your chair. Feel the spine, vertebrae by vertebrae. Breathe in. Breathe out. Feel your fingers. Feel the tips of your fingers. Your fingers, they help you write. They help you type. They help you work. Give them thanks. Bring your awareness down to your hips. We sit on a chair all day. Check to see if they're okay. Bring your awareness down to your legs, your thighs, your hamstrings. Are they tight? You can stretch your legs, your calves. Breathe in, breathe out. Your legs, they help you walk. Give them thanks. Bring your awareness back to the tip of your nose. Feel the life energy of prana go in and out of your body. You're resilient, you're resourced, and you're here. Breathe in, breathe out, and open your eyes. All right, thank you so much for participating in a quick meditation of body scanning. You can use it whenever you want, preferably every morning before you start work. And you can use this short meditation throughout the day to make sure that you're checking in with your body. So thank you for participating in our morning meditation, and we'll get the session started. So we have structured this workshop in 3 big buckets. First is really talking about how do we know how harmful systems are showing up, right? So really increasing our awareness and what we're noticing, right? And so we're going to have our three speakers kind of go over that big question. So to reiterate, the first bucket of conversations we're about to have is specific cases and examples of how systems continue to traumatize and harm people of color and LGBTQ communities. How does it show up in dealing with the systems, and how does it show up in the work that we're doing? So we'll start with Dr. Boyd. Feel free to share your slides if you'd like or not. I'd leave it up to you. And Sonia and Rose, you can jump in. But if you'd like to go in an order, we can go Dr. Boyd and Sonia and then Rose. Thanks.
Thanks. And feel free, yeah, to call me Ria. I appreciate you calling me Dr. Boyd, but in this space, feel free to call me Ria. I am going to share my slides just for a few slides. I'm a visual learner, and it sometimes helps me to put a visual to what we're talking about. So I want this to be a healing space, but I also want this to be a radically truthful space. And so I think for me, the ways that we know that systems are harming people is because we know that racism ultimately shortens people's lifespans. It kills folks, right? And when we know that it kills folks, I think it's important to embody that. And I felt like this quote from Ta-Nehisi Coates, author, Atlantic journalist, really captured that for us. He said, but all our phrasing, race relations, racial chasm, racial justice, racial profiling, white privilege, even white supremacy, serves to obscure that racism is a visceral experience, that it dislodges brains, blocks airways, rips muscle, extracts organs, cracks bones, breaks teeth. We can never look away from that. We must always remember that the sociology, the history, the economics, the graphs, the charts, the regressions, all land with great violence upon the body. Now, in the setting of that violence that we know is created by racism, we have this language that doesn't quite amount to it, right? When we know that communities, particularly communities of color, disproportionately experience that violence, we either call it a disparity, which recognizes that there's different health outcomes between population groups, or we call it an inequity, which recognizes that those differences, there are some differences which are completely preventable. And because they're preventable, they're then unjust. When we're talking about that violence on the body, we're talking about health inequities, things that are completely preventable. And so then we have to say, well, where does that come from? How do systems contribute to health inequities? Health inequities come when certain groups, particularly folks of color, are made vulnerable. And I put that in red and in bold just to remind us, no racial or ethnic group is innately more vulnerable or genetically or biologically more vulnerable to diseases like COVID or heart disease or diabetes than any other. It's not biologic. We as communities are made vulnerable, and that happens through the inequitable distribution of protections. We don't have equal access to protections to keep us from getting sick, and the inequitable distribution of supports to treat us when we do get sick, and to address all of the adverse consequences that are burdening communities who share this disproportionate burden of disease. And so when we're gonna talk about healing and being made whole, I think we first have to share that frame about the breaking, and we have to be truthful that breaking is truly embodied as a physical experience. And I briefly just want to go through a history of the arc of that breaking, and then I'll pass it to my colleagues. The truth of that breaking is that it didn't start on January 6th. Although we are now having a national reckoning about the insurrection at the Capitol, we know that that moment was presaged by the moments that came before. We might have seen that moment happen over the summer when we saw predominantly white groups take to State House lawns across the country, all protesting having to having to adhere to public health advisements. The most sophisticated of us recognized that these protests were a performance of whiteness and white supremacy, that predominantly white groups did not want to have to be beholden to the same public health guidelines that the rest of us had to be beholden to. At that time, folks then had to then question, well, what was the legacy that led to those types of performances, that led to people's investment in whiteness in ways that directly threatened their health, right? Being out there without a mask in crowded groups threatened their health during a pandemic. This is a great book by Jonathan Metzl, a psychologist from Vanderbilt's School of Medicine, that talks about the last couple of decades of legislation where at a local level and a state level, where electeds would basically campaign on a platform of whiteness. They would say, we shouldn't invest in public education because folks of color go to public schools. We shouldn't invest in Medicaid expansion because immigrants and folks of color use Medicaid. And when people did that, it didn't just hurt the folks of color in your local or state area, it affected white folks too. When you underinvest in any public good, education, healthcare, etc., everyone needs that, not just folks of color. But if we're trying to tell the truth about this breaking, it also didn't happen just over the last couple of decades as electeds campaigned more openly on platforms of whiteness, right? It happened as we thought through the impacts of police violence on people's lives, which this is just a cover from Time magazine that asked that question back in 2015 after police murdered Freddie Gray, asking the question, comparing it to 1968 following the long hot summer of 1967. After an event of police violence and national uprisings, we have to trace this history back from now, back to the 60s. If you go back to the 60s in that long hot summer, police violence isn't a problem that just popped up in Black Lives Matters, right? When Mike Brown was murdered in Ferguson, it started much earlier. We could trace it back to the Jim Crow South and segregated facilities and all of the violence that accompanied segregation. But we ultimately have to trace it back to here. We have to trace it back to the fact that our country is founded on a political economy of racial subjugation, white supremacy, and abject violence. And that began during slavery and settler colonialism. The breaking we have to be honest about is that our political economy has profited from the very beginning to today off of racial inequality. That political economy takes resources away from people who have the greatest need and relocates it upwards, which we saw happen with some of the CARES Act distribution that went to corporations over families. We have a political economy that then relies on policing and punitive forms of social control to reinforce those social hierarchies so that we can relocate resources upward. Altogether, it's these structures that systematically divest in communities, particularly our communities of color, that separate families and disproportionately pathologize and criminalize minoritized groups. I wanted to give us that frame about the breaking because I think it's important that we have an honest conversation about how long that breaking has been happening if we're going to have an honest conversation about what it will take to actually heal from it. So I'll stop share there and pass it to my colleagues.
Thank you, Rhea. Rose or Sonia?
Rose, if you're okay, I'm going to pass it to you. You know, even in these spaces where we're talking about truth, even some of us, we need our own moment. You know, certainly to react to Rhea's slides and comments.
Well, I want to say thank you very much, Rhea, for grounding us in the breaking, but also for beginning this conversation around the why we're here. You mentioned love and our families, and in the breaking, the story of the breaking that you shared, what has held together our society are the families who, through their individual experiences, but also their individual resilience that has been hard-earned, is really how healing has come to be part of the survival strategy. And I know that in the families that I have worked with and that my mom has worked with, so just to share a little bit of the background that I started with at the beginning of our call, We now talk about public benefits and public charge and how our systems seek to deny benefits to many of us who will need them the most. The reckoning emerging from COVID-19 is an economic reckoning, is an educational reckoning, is a racial justice reckoning, is a health injustice reckoning, is an environmental justice reckoning. And systems continue to seek to deny access to those public benefits, whether by policy or by practice. So the policies that came into being even by rumor on January 2017, with the leak of the public charge executive order and with the implementation of anti-immigrant policies at the airports, at schools, and in many of our health centers. Those are the things, those are the aspects that continued the breaking and continue to break our communities, our families, and bodies. And we have now the opportunity, while we're still watching the reckoning that continues in DC around what happened on January 6th that was seeded by 300 years of history, we do need to look to our families and the families of choice. So I know we often talk about families in terms of biology, but for many LGBTQ community members, it's really the families of choice that help us heal. And so I appreciate that message of love, because what will get us through this is certainly the realization that the systems continue to create the breaking and the harm to communities and individuals. But if we can restructure, reconfigure, and revision or re-envision those systems in a way that reduces harm. So the work that my mom did when I was a child was to help newly immigrated individuals navigate complex systems of the courts, of the social security system, of the food access system, in order to get access to the public benefits that they needed. And as a little girl, I would often go with her on her case visits and listen in on stories of monolingual immigrants in Hawaii as they were trying to understand, well, I'm eligible for, food assistance, for food stamps, but they give me all these forms and I don't understand these forms. Fast forward today, we now have elders who may not have a smartphone and a device that allows them to quickly access a COVID appointment. And so there are stories of folks sitting there with 2 phones, waiting for 6 hours, and then going to sites and waiting for 6 hours without chairs, without access to restroom, without food, without water. And the breaking continues. And so how do we revise and restructure those systems so that these barriers are not there and that we can learn how to heal and use love to lead the way, especially in caring for elders. Sonia, I know earlier when Mihei was walking us through the conversation, we had a real example that you shared about, folks having to go through multiple systems and seek assistance. And I wonder if you could reflect on that example and the systems harm.
Certainly, and thank you, Rosemary and Ria. As Rosemary said, thank you for grounding us and for setting a tone where we have to look at the background and we have to do it honestly. And I want to just really begin by saying I find myself in multiple systems. My life is driven by a variety of systems. So I'm a Black woman in America. I grew up with 2 mothers, very fortunate for that. And I'm married to a Muslim. I am the stepmother of a 10-year-old who is a part of child services system because of his background. Something that happened in his background from another parent. I have family members who are on public assistance. I have family members who are doing extremely well financially and are invest in large corporations and work in large corporations. And I am working in the nonprofit sector, I used to work in corporate America. My life has really interfaced with, oh, and 3 years ago, I took a terrible fall and ended up in ICU. And because of where I fell, I went to county hospital. And I spent a few days there, and almost didn't make it, but and the system contributed to me almost not making it. But family, as a protective factor, stepped in the gap and ensured that the hospital took better care of me than they had initially planned to. So I say all that to say, we navigate, we walk through, we are sometimes beneficiaries of systems, but too often for marginalized communities, those systems, have their knees on our neck, their hands over our mouths, they cover our eyes, they fail to deliver what it is that they are charged to do by their very existence. And that for me continues to be a source of angst, a source of my own individual rage occasionally, and a source of the reason why I do the work that I do every day, and why I did abandon a lucrative corporate career, because I continued to watch the pathology in our communities, and I knew that even writing checks, when I used to be one who would donate to organizations, even writing checks that I felt could be beneficial was not enough. And now I find myself daily in a line of work, in a sector that is often marginalized. I mean, even when you say nonprofit, it already alone is telling you that it lacks something. The nonprofit part of it, meaning that the profit, even though in the corporate arena we look at profit as a gain. So when you say you're in a sector that is nonprofit, you're almost saying this is a sector where gain is not possible. And that alone is a problem. So I come into this space, with I call you all leading experts. I mean, Rhea Boyd, I follow her, I listen to her, I try to read what she's reading. Rosemary has been an advisor and a trusted source of encouragement and consultation and sometimes coaching with me, literally since the first week that I started my role 6 years ago. In the California Black Women's Health Project. And so to be in this space with you and with CPEN, who has taken on an enormous load of, looking at pan-ethnic health, and who admittedly, has even faced its own challenges with, addressing such a complex and varied issue. It's because we come together in spaces like this is what gives me the hope and the possibility of moving forward. It's where I learn daily, to understand more, especially communities where I'm not connected. So while I grew up with two mothers in my household, there was a lot that I failed to understand about gender inequality, particularly in the LGBTQ community, even though I grew up in a household like that. There was never the sort of the question of, how do we, we were maybe more of a closeted family. I would have to say, it's only in my, teen and adult years, have I really, sort of outwardly began to recognize, what it looks like when people stand boldly in their own truth in that space. So, and there are those systems that constantly deny, reject, abuse, and harm. And I'm glad we're going to talk about healing and harm, because I have what I really believe is a lot to say about that, and where we can go and what the expectations are. So thank you to all of you. I appreciate this time that we have.
Thank you so much. So I think, like all of you said, understanding breaking, and that's where we started today, right? We historically and in our personal stories, which are powerful vehicle in getting us continually being inspired and being motivated to do this work. The personal is political. And so we started with breaking. And so let's go ahead and move on to healing. I know each of us, we are in our own ways contributing to the various healing modalities that we'd like to see scaled up, expanded, inspired, right? So tell us a little bit about healing. What is healing for you? And how do you contextualize healing in your work and in the context of health equity, if you'd like to use that terminology? And also, when you talk about that, I'd love for you to think about, again, like integration with the systems, right? Because we talked about breaking in the system. So when you talk about your work and your relationship with healing, that as a modality, also I'd like you to reflect on how systems must change in order to integrate itself to that healing. So I don't know who wants to go first, but whoever that feels inspired can go first.
So I'll jump in.
Thank you. Thank you.
Sonia, thanks for your reflections and sharing. I know you've also shared with me what it's like to navigate some of these systems. So in the role that I play with the California Community Foundation, I also chair the LA County Hospitals and Healthcare Delivery Commission. And through that work, have come to see and understand the barriers to accessing care that individuals who are in the jail health services, which is under the supervision of the Department of Health Services, and also the community members who access care through a program called My Health LA, which is health access for individuals who are ineligible for the Affordable Care Act or for Medi-Cal because of their immigration status. And when we play this role as commissioners on the commission, our job is to advocate for, so the for whom, are for the individuals who would otherwise be denied care by systems or have care that is perhaps not exactly what they need. And so part of the role there really is to bring light to the injustices that are happening, and then use the examples and experiences that are shared with us by community partners, including the community clinics, to make it right, make it better. So part of what Mihei and CFEN asked us to do today is to shed the light and bring awareness to how specific harms are caused. And part of the healing really requires that we join in some of this hard work. And I appreciate that several of my colleagues from the philanthropy space are also on this call, and I have seen you in the participants list. And we as members of this very, I think, small group of folks who work on foundations also bear an added responsibility that how do we use the access and the influence and the advocacy assets that we have to then also sit at tables and create tables where those who might most benefit are also the decision makers. And I think that's something that continues to be an ongoing learning space for me. Often there is this, I think, dynamic that we often recognize, and Sonia has mentioned this as a philanthropist herself and now working with philanthropists, how to have these honest dialogues about the harm that a request for proposals might cause by requiring a fancy logic model or requiring an evaluation plan that will not necessarily be funded by the grants that an organization like a community foundation might make. And I once shared with a fellow funder, we decided not to require logic models when organizations applied to grants at the community foundation. And this funder looked at me sideways and going, why would you do that? How would you know that they're going to do what they're going to do? And I looked at this funder, I said, because I understand their business model. I understand the requirements that the community clinics and these health providers and advocates are required to, put into their work. They get audited on a regular basis. I've seen financial statements, and so we learn that, the way that it is isn't the way that it has to be. And part of that healing really is just to be, as Sonia has described. We coach one another. Like, why are you doing it that way? And do it a different way. Do it a way that makes sense with our partners. So it is a learning journey, and one that I think takes years. And hopefully we don't contribute to a breaking in the future. And if harm is caused, then I have been grateful for the correction and education and redirection of colleagues and partners, including folks who are on the call today.
So, Rosemary, as you talk about, what we do to contribute to the healing, I'm often, called on, and I'm going to be speaking somewhere next week too. And I'm just thinking, they said, can you please come and talk to us about what does it take to heal? I thought, okay, what does it take to heal from inequity? And what does it take to heal from racial trauma? And, in other spaces, I say that healing really requires a very complex and a fragile process. So if you think about, a wound, on your arm, or, a wound on your hand or somewhere on your body, there's stages of healing. And for all the medical professionals out there, Ria, I know, you're a health professional, MD, I believe. The stages that talk about clotting, then there's an inflammatory stage, and then there's a stage where the new tissue starts to, form, and then there's the maturation of that tissue, and ultimately you see what may be a scar, but it's healed over. When we look at inequities, and we look at trauma, and we look at, the harm that has been done by systems, the healing could follow along that complex, fragile process. But I say that it cannot until the harm ceases. You cannot continue to poke a wound and expect for it to heal. And what we live through with the systems that we interface with, whether it's the criminal justice system, whether it's, courts, where you have fines for even something as simple as parking tickets, whether it's our healthcare system, or our school systems, when the wounds, the historic wounds are continued to be pricked and pricked and pricked from a whole host of needles and pins and, slights, and, the healing really is not possible. So what we have done in our society is we continue to use the word resilient, and we talk about resiliency as what sounds to me often as an alternative to healing. The bounce back, the ability to recover. In recovery, says, did you recover? Or are you merely coping with a thing so well that it's suggesting that you're able to handle it? So therefore, if it happens again, you just continue to receive it, and you say you've bounced back because you're still standing. And people say, particularly for, we hear this, when we talk to people who are trying to navigate the healthcare system, and they go in, or they talk on the phone, or they're standing before a health professional. And even if you're Black and you speak what, we consider, the Queen's English, your conversation with the health professional can often look like, two people speaking different languages, and then they both walk away, and one assumes that the other understands what was communicated. The other walks away thinking, I have no idea what that person really said, but let me try to interpret what I can. So I hear that, from a system currently, where there's an elderly person experiencing the results of a stroke, And now the family is trying to understand, what is the doctor advising to be done? And it's as if there's like this, you know, you see it on the cartoon, wah, wah, wah. And you can read things. And I took a picture too of the pages that came with the, you know, the after, you know, the after visit summary. And I thought, you know, I have an Ivy League education, you know, quite well versed in a number of things. And I have to use a dictionary on my computer to look up, you know, some of the things that are there for the family to see. So, you know, I think about, you know, that healing, and I just say we should not be talking about necessarily healing until we can talk about the discontinuation of this ongoing harm. When you have trauma, you know, what does it say? You establish safety. This is how you recover from trauma. You establish safety. You talk about the trauma. You tell the story of the traumatic event, and then you surround yourselves with others who can, you know, help you to feel safer moving forward. So that's only possible if you are not expecting the harm to happen the next day, or if you don't think about, you know, last summer, or you don't think about January 6th, or you don't think about all of the things in Dr. Boyd's slides. So we can manage from day to day, but healing until the systems actually change and serve us the way they should, I don't really see healing as possible. But I do see management until we can actually work on those systems to serve us better.
Thank you both for what you shared. I'm going to pick up right where you left off, Sonia, and talking about the ongoing harm, the fact that the breaking hasn't actually stopped. I just want to put some contours on that for us, because probably many of the people who are kind of attending this session are a bit aware of the breaking, and we imagine ourselves as working inside systems or programs or projects that are trying to stop the breaking and kind of mitigate ongoing harms. But I want to kind of frame the full contours of that ongoing breaking, because it includes things like doing nothing. It includes things like saying, I know police violence is a problem, or I know that certain funds that flow out of our organization flow more to these types of organizations than these types. Like, I'm aware that these things are going on. I know segregation is a problem, whatever the issue is. I'm aware of it, but yet that's not my bailiwick. That's not what I'm going to take on today. I'm not going to bring it up at the meeting today. Like, part of that ongoing breaking is the inertia and the passivity many of us have, and I include myself in that us, around the many ways that harm continues for other people. So one, sometimes that ongoing breaking is because we're not doing anything. The other ways I think it shows up, even for us in this helping sector, is that we highlight our values and our best intentions despite knowing that it has a disproportionate impact on certain communities. We say, we know that hurts you, but listen to what I believe. Listen to my values. Take me at my best intentions, not at the impact that my system had on you as a community or an individual. I think even just spouting our best intentions or spouting our values in the face of these ongoing harms is a part of the ongoing breaking, because it's evasion of the truth, which is that despite our best intentions, the breaking still happens. So at a certain point, best intentions are completely irrelevant. And to continue to raise them only delays our process to do something about the impact. I think the third one that can come up, that honestly came up for our coalition that is trying to address or get our state to declare, our governor to declare racism as a public health issue. The other way this shows up is people say, okay, I agree racism is a problem, but tell me a short-term solution or point out some low-hanging fruit that we can target. I think that is a part of the breaking. There are certain people, when you say something is wrong, that we act urgently to fix the problem. We will invest in fixing that problem indefinitely until it is fixed. And there are folks, and this is predominantly folks of color, who live on the bottom side of the racial hierarchy we have, who we are willing to allow problems to languish. And when they finally are presented to us, say, well, give me the easiest, quickest, fastest solution so it can look like a win. That is a part of the breaking. So if we want to do something about this, don't talk to people about your best intentions or your values. Never offer them low-hanging fruit. This will take a longitudinal
commitment that begins with telling the truth about the breaking that, as Sonia, I think so well said, is ongoing. So that is part of what I call and what I rely on in the truth, reconciliation, and reparations framework. That first we have to tell the truth about the breaking. We have to apologize for the ways that we participate in that, even if it's simply just passive participation. And then after we apologize, we then have to actually repair each of the very specific ways we as individuals or as projects or as organizations or as members of systems have contributed to that process. I think the process to actually repair it often is put into buckets when systems think about it. Sometimes we offer kind of equal solutions where we offer a universal solution to everybody, like universal healthcare, for example. We try to give everybody health insurance. But that still won't eliminate the barriers for people who live in areas where either the healthcare that you receive is so rife with discrimination, it's unacceptable and low quality, or you don't live near or proximate a quality healthcare center, right? So even just a universal solution doesn't always work. And so we talk now a lot about equity, which means we're going to try, our systems are going to try to match the resources that we give to the needs of the population that we're serving. But even equity falls short, right? Because if we're not in the game of actually unlearning and dismantling the structures that required people to have these needs in the first place, then we're still just on the side of like Band-Aids and short-term solutions and not on the side of actually rebuilding our systems to serve people better. And so I also think after we are ready for the point of reparations, we have to take a liberatory frame to actually think about what it means to unlearn and dismantle at the same time that we are imagining and rebuilding systems that look fundamentally different, which also means that we have to be willing to have access to less power than we have now, myself included. As a clinician, I'm a part of a provider class. That means I have a certain earning in our society. It means people treat me, you know, when I came on this call, people were like, oh, Dr. Boyd, people treat me with certain deference when you know I'm a doctor. And when I walk on the street, people don't know. But, you know, in settings like this, that is some advantage to me. And I carry that social capital. And so when I'm talking about relinquishing power, I am even talking about people like me to think about how when I perform my work, I am centering at the margins as well. I am centering how our projects run around folks who don't have that same access to power and platform like I am given as a clinician.
And Dr. Boyd, Ria, you know, one of the other things, or I should say a couple of things that we can do, you know, while we await or while we, you know, hopefully watch and observe those systems, you know, attempting to make some change is, you know, what the Black Women's Health Project does. We work very hard to build the community's capacity to stand in the gap, to care for itself. You know, we know for many of the issues that face communities, you know, the answers and the solutions, the preventative options lie within. You know, we know culture, you know, as a determinant of health, determinant of mental health. We know that, you know, historically, you know, we have pockets of communities. You look at, you know, midwives, you know, in history and their abilities to care for babies and to, you know, bring about joyous births in our community until, you know, that system in Black communities in particular was dismantled because of, you know, the traditional healthcare system. So we look at really, you know, how do we build capacity? How do we strengthen the resolve, not to say be more resilient, but how do we train our community and provide resources in the community so that, you know, we are navigating. And when I say navigating, it's a little bit tongue in cheek because it's ducking and, you know, it's circumventing and it's, you know, climbing over things and it's busting doors and it's sneaking in the back when you have to in order to get access to what you need to take care of yourself. So that capacity building piece is so strong. And then, you know, as CPEN, you know, is a part of a larger project in the state of California, California Black Women's Health Project, a number of organizations. We talked the California Reducing Disparities Project, funded by the California Department of Public Health. we are working on building community-defined practices and uplifting and elevating those practices such that ultimately, the healthcare system, where it says we don't have the solutions to really care when there is, one day of an admission, that there is a problem that isn't being resolved. Okay, well, how can we uplift and integrate those community defined solutions that are operating alongside of the traditional systems, that are not culturally, directed to care for us, that are not, you could say competent, culturally relevant, culturally, caring. So the community defined practices, building the community's capacity, that's where I see the community as a system of change, where change is possible more urgently than I see it in these structural systems, that the community has to interface with. So when someone wants to talk about, the system as a community of change, that is where I look to source out additional funding, additional, experts, bringing in, universities, bringing in, the power of thinking, bringing in, the evaluation models. Things have to be evaluated, and those, to me, that evaluation can take place in concert, with the community, not on the community, but involving the community and being even directed by the community. We will care for ourselves until the systems that are structured to do so do better. We will do it internally.
And thank you to Mihei and the CPEN staff for embedding in the chat CPEN's Racism as a Public Health Letter. I think each of us as panelists today have reflected on how racism continues to be part of the breaking that structures our lives, our work, and the for whom and why we're here on this panel today. I want to uplift and spotlight Ria's comments earlier that don't pick the low fruit, don't offer the low fruit, go for the long-term solutions. In philanthropy, I think we now recognize the harms that have been caused. And so there is an awareness. So folks are awake, but moving into the woke stage to really do some of this hard work over the long term is something certainly that a community foundation understands and is working on. We make long-term commitments, 10 years in our strategic plan. Our present CEO says, poverty is not going to be solved overnight. We do not need short-term solutions. We need the long-term solutions to advance our communities and to change the way systems operate. And so I certainly appreciate the comment that don't work on the easy. And then in the long term, the work to maintain the changes, I think, is what lies ahead of us. We are in a phase where our governments are realizing and perhaps becoming awoken to what needs to change. But the long road lies ahead of us, that these systems changes, as Sonia has also mentioned, it will take the individual working within the family and the families within the communities and the communities within our society to really bring about the change that we desire and hope for. And so I appreciate the chance to have this very different kind of conversation. This is unlike any other panel I have been on for many years. And so I appreciate the gift that's been offered by CPEN to have this kind of conversation. I appreciate meeting Ria and being on a panel with you, Sonia. It's a real gift.
Thank you, everyone. I think, if for attendees, I can't see your faces, but if you'd like to, stick around and ask some questions and raise your hand, we'd like to hear from you. But I think what my personal takeaways from these conversations is really at different structures, acknowledging the truth, really knowing, the breaking and seeing it and confronting it. And I think that's part of the racism as a public health crisis, declaring that, right? Like you are really confronting it and acknowledging the truth. And I think also the universal solutions doesn't always work, and acknowledging that as well. And my biggest takeaway is that lowest hanging fruit short term, right? Like I really hear that a lot of the times in different spaces, and having the courage to push back on that, right? That's part of being an ally for me, is like having the courage to lift up my voices, to point at long-term solutions, that reimagined system. You know, what does that look like? How do we want it to feel, right? Interacting with it. Do we want it to continue to poke, you know, our wounds, or do we want to feel safe? Do we want to feel taken care of, you know, and what does that system really look like? And in the meantime, because it's called a struggle for a reason, you know, in the meantime, we really focus on resourcing our communities and really stopping the word, like, just be resilient, You can take on a little bit more. Really, no, right? We're going to say, you know, we're here to resource you, and building up the community power, you know, is really the solution in the meantime. So thank you, Sonia and Rhea, Rose, for your passion and your commitment and all your voices. I'm gonna see if there's any raised hands. Actually, I can't see the participants. So Carolina, if you don't mind, like, seeing if folks have raised their hands to just chat and, you know, tell us hello. The chat box is, there's a lot of gratitudes and thank yous going on. I don't think that there's anyone who's raising their, oh, there's actually Eden. Oh wait, Eden, hi. Where are you?
I got unmuted. Hello, can you hear me?
Yes.
Okay, hello everyone. My name is Eden Moussier, and I am a health equity program manager at Blue Shield of California. And so thank you, all of you today, because this has been something I've been thinking a lot about. Like, I've always found in my professional career working towards health equity, but sort of in my personal life thinking a lot about healing and what that looks like. And so having those two conversations intersect has been great. But something I've been thinking about is, we talk about like equity in practice, right? Or health equity principles, and talking about how it's super important that we center like, you know, Black, Indigenous, and people of color, right? Marginalized voices in not only like the upliftment, but also in the co-design or the co-creation. And it hit me today, and I thought, is there an unintended consequence in that? Like, are we adding more harm? Are we saying communities of color, you know, my communities that I come from, fix the problems that white supremacy created, right? Or, you know, these other systems created, even though we're trying to act in the value of equity. And that's something I'm trying to reconcile with. And I'm wondering if any of you have any thoughts on that, because, you know, in good faith, right? Equity principles or living in those values are good, right? Good intentioned at its core. But then when I think about the context of saying, okay, we're now going to those who are most impacted and often less resourced to fix the problems that they didn't create. So I would love any thoughts anybody has on that.
I see Sonia shaking her head. I'll just briefly say, I'm glad that you raised that. I think I want to be clear, when I say centering at the margins as the ways that we develop our equity approach, what that means is centering at the margins should be our way of seeing things. If I can, hold on. I'm going to show you a figure. Oops. Hold on. I'll show you a figure that captures that brings in what we usually talk about when we mean centering at the margin. Okay, hold on. Sorry. Here we go. Okay, got it. This is sometimes a figure that you see people put up when they're talking about the difference between equality, equity, liberation, and then what I've been talking about, which is where I think we need to move, which is towards love. So equality is like everyone gets the same, you know, little stump. Equity is you get the stump based on your height. Liberation is like get rid of the fence, right? But centering at the margins means we have to have a new way of looking at the problem or the breaking as we've described it.
What centering at the margins means is if you're actually on the other side of that fence, it's not that somebody is shorter, right? It's not that somebody is innately without the resources they need to survive. It's that people are divested in. Some people are living in holes of our collective creation, or some people are ensnared by the criminal justice system. When we center at the margins first, we can't even see what's on the other side of that fence, right? In the other figure, it's like this baseball game and you could see what you might be missing. When you center at the margins and we actually put the orientation of our analysis at the people who are most affected, then this whole wellspring of other issues come to our attention. It's like, actually, it's not that somebody's shorter, it's divestment. It's not that, you know, you needed a bigger box. It's that you're ensnared in the carceral system and that some people inside of your barriers, they have a box just out of the blue, right? Privilege. They have advantages that other folks don't have. So I share this figure to say that I think it's important to understand what we mean when we say centering at the margins. It should be a way of looking and understanding and analyzing the problem, not a way of determining who is the workforce that then is burdened with fixing the problem, which is a really brilliant critique of yours, because it is one of the problems that then folks of color are the ones who are asked to fix it, which is not the way it should be.
Yeah, I appreciate that clarification and also the visual, Rita, that you shared. One of the ways that I think this question also comes up, particularly in philanthropy, is, well, should we have a committee on it? Is there a person that's in charge of it? And a colleague of mine asked this during a session when we were training some of the new foundation staff across some of the Southern California philanthropies. And my response to it, I don't think was very popular. I said, well, why do we segregate it? Why do we put it in one person, in one committee, as if it's not the entire responsibility of the entire organization? And so often we get assigned, and Ria and Sonia, I've heard, I think in your comments, right, we get called on to serve on these committees, on these panels, on these bureaus, because folks want a quick fix or one answer that solves the problem, when really the answer is over years, over time, across desks, across units and programs. And so again, I think the idea of centering at the margin also draws on this sense of, and it is part of the whole weave. It's not just one thread in all of it.
And Eden, I'd like to add that, you know, there can be a variety of reasons why you have a disaster that happens in a community or in a neighborhood or in a home. And yes, we do know where maybe the structure and the system of blame exists, you know, for many challenges, but the space needs resources, and the space needs an opportunity for some type of recovery, even though it won't be full recovery. And even if it's recovery until the next time the bomb drops or the next time something happens. So, you know, we don't see it as much in the United States, you know, where, you know, there's this war-torn experience that communities are facing. But there are, you know, sometimes in those spaces, resources that come in to rebuild, to, you know, give people at least some shelter, some type of protection, you know, so that you're able to at least, again, like, not heal, but survive till the next day, with the hope, you know, that ultimately the earthquake will stop, or the bombs will stop, or in this case, in the United States of America, we will dismantle the systems of racism, inequity, and harm and marginalism that impacts so many of us in this society. So we do go to the community, not to say heal yourself, although I do strongly believe that we are building resources, you know, within, and building our capacity. But, you know, Ria talked about the divestment. So the reinvestment, or not even because in some places there hasn't been even an initial investment is key. So investment from philanthropy. I also believe extremely strongly that our corporate sector must do more, because a lot of the harm that we experience in our health are the things that we eat and consume, and the air quality, and those things that our corporate community is adversely impacting, and they should be charged with adding more strongly to help. So you've got the public sector, you've got philanthropy, you've got the corporate sector, and you've got these communities where the needs are so great, and the investment is absolutely what's necessary to at least get that community to a point of safety where they can live another day until we can dismantle those other systems.
Thank you, Sonia. Well, I think we've gone way over time. It's 2:40 now. There is office hours happening, so folks can run over there. But I know, Ryan, you raised your hand. I don't want to not hear from you. Do you want to chime in and say hello?
Sure. And first, Ryan McClendon with Public Health Advocates. I'm a program manager over our First Response Transformation Campaign. And just, I have to give kudos and roses to the panelists. This was amazing, very thought-provoking. Dr. Rhea Boyd, got to give a shout out over there. See you. Dropping gems as always. But honestly, even just hearing the last section and kind of that response and the questions from the attendees is giving me so much to process. So forgive me if my question isn't as clear, and it might be even more of a statement, I guess. Especially when we're acknowledging what systemic change looks like in the healing that has to occur. And Sonia, I think, did such an eloquent job of naming that you're really not healing if the harms are still being done. And then even the follow-up from Rose about the implementation process of, like, how do you really look at systemic change, not just happening with one body or one policy or one team, but literally being interwoven. My question really kind of centers around when we recognize that the low-hanging fruit can be very harmful, and that it definitely keeps us in this minimal progressive state versus actually getting what we need and saying what we need and what we want. There often is this where the rubber meets the road of, okay, well, we have this bigger thing that we're making a statement on, i.e. the California bill saying racism is a public health crisis. Now, how do we implement that, and how do we get there, and what does that actually look like? It seems very tangible that you would have that approach of every system needs to look at racial equity, or a JEDI committee, if you will, justice, equity, diversity, and inclusion for everybody that they have, to see where those policies are at. But then how do you implement them? How do you actually put them into practice? And at what point are you reviewing them to say, are we actually getting there or are we not? So I guess my question to the panelists is, what would that look like from a statewide lens that can start rolling out the practice and the structure that other bodies, entities, institutions can roll out to actually practice and measure those outcomes and actually get to a progressive point where we're actually starting to address the harm, so we actually are finding where the wounds are at and the depths of those wounds, so we can properly heal them versus continuing to harm them because we don't know the depth of what that damage has been, especially when you look at every aspect that is systemically affected by white supremacy, racism, and institutionalized racism, for that matter.
Ryan, we could actually be here all day unpacking your question, and I wouldn't mind, but I know that there is, a conference going on. I appreciate you articulating it that way, because it's an enormous challenge. It is an enormous challenge, and I don't subscribe to the low-hanging fruit, or they say eat an elephant one bite at a time. I hate it when people say that, but I will say that I have some past work in diversity and inclusion in the corporate sector years ago. The mandate, the work starts at the top. There has to be a mandate from the top. I really do believe that is absolutely necessary. And it has to come from the top down, because the bottom up is already working on it. The bottom is already holding more than it needs to. The top. So in our case, the governor, and yes, everybody says, well, COVID, oh, we're so busy with COVID. Well, COVID is a manifestation of all of the things that we are seeing from our history in this state, in the nation. But let's just talk about California, since you mentioned, what can we do at the state level? I mean, Ryan, the governor has something that he can do, and he can match it with the appropriate level of resources so that it is mandated to go from the top down. And then the bottom, which is already doing work, maybe there's an opportunity to meet in the middle and we will ultimately see some systems change. But until we have something happening at the top, and it can't be watered down. You know that it can't just be a mere declaration or a mere executive, or it can't just be, it has to come with some teeth. Otherwise, we all know better. We know.
I'll only add, Ryan, thank you for that brilliant question. I completely agree with Sonia. This is, and with your formulation, that this is an enormous problem. It's longstanding, as we outlined. And so it's going to take a huge effort that can feel really overwhelming. But here I turn to the words of Audre Lorde, who said, you can't dismantle the master's house with the master's tools. Like, if we approach this with their language and with their frame to say we should have a strategic plan, and that strategic plan should have short, intermediate, and long-term goals. And those goals should be measurable, and somebody should be held accountable to that measurement. Like, even just that way of thinking takes us out of the frame that the community has been pushing for decades, if not centuries, which is abolition. Like, there are some pieces that are so problematic that we have to completely get rid of. Abolitionist efforts have been pushing the state to make huge changes. I was just on a call the other day where advocates were talking about how, we as a state are no longer going to have juvenile state prisons. Like, that is the work of true abolitionists. That then liberates an enormous amount of funding that now we have to have a place to put. And so I also want to hold in this big process where we're going to have this negotiation with the state government about what they should be doing, that we have our own tools to direct how that should go. And some of this needs to be stuff that just completely disappears and liberates the funding that used to go to that thing. And then we reimagine what it can go to. Like, once there is a world where you don't have juvenile prisons, what then do we do to help rehabilitate actual offenders who are, who do need some type of social and emotional investment and development so that they can live different lives as healthy adults in hopefully healthy relationships? Like, what would that take? What infrastructure would that take? How much would that cost? Like, I'm also hoping that what comes out of this process isn't a 10-point strategic plan and a task force and an office, but a space to imagine and a space to build with money that is liberated from part of the harmful infrastructure we know exists that many have already been working to abolish.
That is an amazing example, Ria, and I appreciate that you uplifted how California can and hopefully will reimagine the use of those dollars. And I would offer that in Hawaii, the use of those same kinds of dollars, they are paying it forward as part of the justice reinvestments, and I would argue reimagination efforts in the state of Hawaii, using dollars that they know they will save from incarcerating people, including young people, and using that money based on an estimate to provide housing and assistance to people who are experiencing homelessness in the state of Hawaii. So it can happen. It has happened. California often likes to think of it as the forward wave, but there are other places and states where they're paying it forward and using the money that would otherwise have jailed our people and putting folks into houses and spaces where they get care for their mental health and substance use needs. And so it can happen, and there are ways that, we don't have to wait for California to play the lead. There's other places, and we can use those efforts as a way to mark the path forward for us.
Awesome. Ryan, you were saying that you were not like articulating that question eloquently. I don't know what you're talking about. I want to give you that rose as well. Thank you for asking those questions. I'm like borderline in tears. And I think it's because the place to imagine and place to build, it is so rare. I want these places, I'm hungry for these places so we can build and imagine together. And really, we need to create more spaces like that, right? And so I think I'd like to close this workshop. It's hard to close this workshop, but I'm going to close it so y'all can go to the tech office hour. If folks have any questions about any like technological challenges, I still see 38 participants in this Zoom room. And so, you know, feel free to head over to the office hour. Thank you for joining. All the slides and all the presentations will be shared with you all. And I really hope that, you know, the panelists can connect with some of the participants as well. It's our intention to, you know, build and make new connections and network. So feel free to keep talking about this. I think for panelists, if y'all want to stay and we can debrief a little bit, and CPEN staff, if you want to stay as well, that would be great. But yeah, we're ending the workshop. Thank you so much for coming.
Thank you. Thank you, Rose and Sonia.
Thank you, and thank you for the panelists. Bye. All right. Yesterday, I had to kick some people out. They were lingering.
Just like a real conference where you hang out in that session that you really liked. You just hang out in that room and hopefully you get to talk to the speakers.
That's exactly what I do, yeah.
I find
That's like, yeah, yesterday, right?
That's how I.
Yeah, yesterday we had this. What was that, Sonia?
Oh, that's how I connected with Ria the first time, because I just stayed on something where I heard her speak. And then as they were trying to put people, I was like, wait, I need your contact, you know, so I understand that. Yeah.
I'm with you there, Sonia. I've done that as well. And Ria, I hope I get to meet you in person at some point. If you're still on the call, I don't know if you still are, but really appreciate your spirit and comments.
I think maybe she clicked Oh, I see what you're doing, Mihei.
What is she doing?
She's
yeah, what am I doing? I don't know.
What's going on?
I don't know. I don't know. Oh, it looks like okay, it's just us now, and okay. I don't know if Ria left.
Ria, I think
if she left, that's
she
totally.
Probably thought that.
Yeah, she might have had to go to another call.
But thank you all so much.
Okay,
thank you all.
Yeah,
thank you.
Just wanted to, you know, take a moment to debrief. How are y'all doing, and you know, how did you feel about that workshop?
I thought the meditation was very helpful, especially because I know people are switching from the sessions. Hopefully it went in a way that you felt was consistent with the way you prepped us. I know we had a different vibe going on because of, I think, having all of us on the call, but I thought it went really well in terms of just the dialogue.
I also greatly appreciate the meditation, Mihei. And I even wonder if, you know, maybe like in the future, we think about how to build one in at the end. Because sometimes, you know, we unpack spaces and then, you know, people, even though you can walk away with, you know, what you're experiencing, but, you know, sometimes you just, you know, need another moment to breathe before you move into the next thing. So,
yeah. When it flowed
well, I'm going to try to build that in.
Yeah.
Go ahead, Rose.
Yeah, and it flowed well as well because Ria's slides were then about how racism visits us on our bodies, right? The breaking happens to our bodies and the other aspects of us. And so then to be aware of one's body and like the tension that we're holding because of our experiences and the historical experiences, I like there was this really elegant thread from the meditation And then when her slides came on, I was like, oh, I didn't know if that was intentional. You knew that she was going to throw up sort of these kinds of slides. I haven't seen her present before. So it was really special to be able to be on a panel with her today. Thank you. That was a real honor.
Definitely. Definitely. So,
Awesome.
and you know, I had slides prepared and could have sent them to you in advance for review, but I had them. But you know, I thought, you know, it might be better just to, you know, when I could see some of the names in the audience, and there were a couple of people that I recognized, and I said, well, you know, in some ways, you know, we are having a preaching to the choir conversation, or you know, singing to the choir conversation. So, but I hope it was helpful. I hope the participants found it interesting to at least to reflect on these things again, that I'm sure in their line of work they're already working on in some way.
Mm-hmm. Yeah, I think that, I mean, the all call to action to me was, you know, they need constant reminders because it's really hard to keep, you know, challenging and to keep sort of going to the not status quo and not inertia, you know, like it's like hard to go against the inertia. So I feel like in these spaces, it's like, you know, we need those reminders. And I think, Rose, I really appreciated your call to action for foundations and funders. Like,
Dump the logic model.
You know, that was
the logic model.
Yes.
That was
the logic model. The
that was a major national foundation that looked at me sideways like, you dumped the logic model. What kind of program officer are you? I love telling that story. I still interact
the kind that every CED or CEO loves, because, you know, something so unreasonable. It's like, okay, really? I'll go and design something. And then there, you spend your time looking at it and you tell me that it really changed your decision.
So true. Carolina staff, Monica, CPEN staff, y'all doing okay back there in the backstage? How are y'all doing? Just want to bring you in for a quick debrief.
How do you all sit so still? I'm like that Twitcher person. I'm always moving. I can't sit still.
I want to, but you know, I once heard that speaking of the Queen's English, that the royals never touch their face. That's part of their protocol, is to look royal and regal. You're not supposed to fidget. So I'm so fidgety, and I also super expressive. And I always think that when I'm in those situations, okay, Kate Middleton, she doesn't ever touch her face. Just sit there, and you know, I'm tech, and you know, just don't do anything. So talk about what I've internalized, right?
Oh, that's so interesting. Yeah, I can't help myself. I'm just like, not to mention my emotions, you know, are sometimes in there too. And I don't know, I'm in hands, you know, my hands are in it. But you were so still. At one point, Caroline, I said, is she frozen?
Yeah, is that a photo? Yeah.
Well, I tried to stay in the background as much as possible, but I was listening very intently as someone, you know, I think, obviously, I kind of had a little snafu with the tech in the beginning with the slide sharing. Shout out to our staff who helped with that. But I think, you know, as I was listening, you know, to that earlier thought about, you know, is this useful? Are we preaching to the choir? Or, you know, I really do believe that we're all kind of, many of us, I should say, are really trying to resist some of the things that I think like Ryan spoke to at the end, and you know, Dr. Boyd and Rose and Sonia around sort of, you know, we can't work within this structure that expects, you know, year over year wins, low hanging fruit, resilience, right? Like really this kind of paradigm shift that needs to happen. And what I felt like was a really strong undertone was each of our positions within nonprofit work and within foundations or within the medical field, what do we actually need to do within our own structures to move that work forward, because we are very much part of the dominant culture and the dominant system. So I was just thinking about, okay, what are the implications here for my work within the context of this organization, and how do we kind of challenge some of these tools that are currently being used to, extend our measurement beyond, the logic model, or beyond, a legislative win? What's the long-term vision here? And so I just was in a space of like reflecting and learning so much from all of you, and I thought it really landed well for me personally. And people were on long after the workshop ended, so it's always a good indication that people really were feeling a lot and learning a lot.
Yeah, like 40 something people, even at 12:40. I was like, wait, whoa, like not only is it into the lunch hour, but it's like beyond what they understood was their time commitment to this. So kudos to the team. I actually have to go cram study for the 1:30 BH SAC call, which is happening soon. But thank you for this opportunity, Sonia. Always a treat to hang out with you. I can't wait until we have a meal together again when we're all vaccinated.
I know, it's been so long. It's been so long.
And Mihai, Carolina, we're going to hang out somewhere, sometime, once we're all vaccinated. So thank you all.
Yeah,
and
I think
I'll see you on the
LA
next call.
gals. All right. Well, thank you, Sonia.
All right, take
The
care.
LA gals need to hang out. All right. Bye, everybody. Thank you.
Bye-bye.
Thank you so much. Are we still hanging in here? Let's see.